My name is Dr. Nicholas Wanjohi. I'm a senior medical officer. Um, when I see politicians flying out or any other high-level people flying out to seek medical attention, it really begs the question why we don't really invest in our healthcare. Most of the things that these people go to do outside there, they're things that are available within the country. So it begs the question, why should we be having public institutions when even the public officers are not able to seek for the same services that they promise the population? In medicine, emotions can run high. That's why we always say, despite how difficult the work might be, you always make sure that you don't carry your work burden to your private life. But we also have ways of coping. We usually have counseling sessions for doctors. Though not available in all hospitals, it's something that is being implemented in other places, especially for those people who are dealing with cases such as trauma, to avoid conditions such as post-traumatic stress disorder. One thing that I really makes me wonder whether Kenyans really understand what it means to run the healthcare system is when we say that we should have people who are not necessarily medics running the important business in the healthcare sector. That's an everyday experience for any doctor. We say every patient comes with their own complexities, and you just try and keep your calm. In medicine, we always say you always call for help whenever you doubt yourself or whenever you're having a situation whereby you're not sure about what you're doing. In medicine, calling for help does not mean that you don't know. It just shows that you're willing to learn something from another person. I think from a medic's point of view, I think drugs they're contributing to the social burden and healthcare burden within the Nairobi healthcare system. You have so many youth that are going down with drugs. I think they do. We have several who are really enjoying, but I also think it cuts. That has nothing to do with being a doctor or not. Medicine really draws you towards wanting to lean more towards scientific deductions. So there's a very thin balance between religion and your work. If you let maybe religion take over, you might lose the focus that you're supposed to have when dealing with the patient. I think I'd look him in there and tell him, Mr. Minister, so many things are failing. So many things are failing. As a doctor who works in the public healthcare system, I think there's more that can be done. I've seen patients die from very treatable diseases. I've seen patients die from lack of very basic things. The management of the healthcare sector at the top really needs to understand that so much of what we want is not being delivered to our patients, including the social health. We've seen politicians and everyone advertising the social health. It was packaged in a good way, but I think the problem is coming with the execution. I'd advise the healthcare minister to look more into those kind of things. My girlfriend. Anyway, I think before you look at who takes care of you as a doctor, you should ask yourself, do you take care of yourself? Because we have so many medics who are going into alcoholism and depression just because they focus too much on the work and forget the play part. Thank you very much.